Hello everybody, this is Alex from SoyaCincau.com and this is a COVID-19 Vaccine Malaysia update. This is a weekly show where we highlight the latest developments of the COVID-19 vaccine as well as the National Immunisation Program. Just another friendly reminder that this update is also available in Bahasa Melayu and you can check it out at SoyaCincau BM channel and you can click the link somewhere up here or in the description box below. When's the next round of AstraZeneca opt-in booking? And if you're pregnant, which vaccine are you able to take? This and more in this week's episode. Before we begin, here are some highlighted comments from the previous video. Tropip said, took the first dose already and you get a fever and fatigue for around less than 48 hours. After that, you'll be back to your normal state. Don't be scared, just take it so that we can achieve herd immunity. Yes, that's right, and thank you so much for sharing. Yes, it's common to have some side effects like fever, headache, tiredness, joint pain and muscle ache in the first 2 days. If you experience any of these symptoms, please report it in the MySejahtera app. If it doesn't go away after 3-4 days or if you experience more severe symptoms, please seek medical attention immediately. Zainah Khan said, "Hi, can anyone let me know what documentation or identification are we required to take on the day of vaccination? If you went for your appointment, please let me know what you asked for. I want to prepare likewise. Thanks a lot." Thank you so much for your question, and all you need is actually your IC or passport as well as your smartphone with MySejahtera installed. And of course, I will recommend that you bring your own pen so that it's faster for you to fill up the consent form. During the vaccination day, there's actually a consultation session where they will ask you about your allergies and any health condition. And if you have any letters from your doctor, you can bring it along so that they'll be better informed about your health condition. Asam Laksayi said, "I'm a Penang but currently residing in Selangor. So I registered for the vaccination under Selangor. Is it okay? Please advise, thanks." Yes, that's the right way to do so, and if you do move to a different location, you're advised to update your location in the MySejahtera app as soon as possible because the appointment is going to be based on your current residential address. If you miss your chance to book the AstraZeneca vaccine on the 2nd of May, well, here's the second round, and as announced by Minister of Science, Technology and Innovation Khairy Jamaluddin, the next round of bookings will be available on the 23rd of May, which is this coming Sunday. The next round will be available in 5 states, namely Selangor, KL, Johor, Penang and Sarawak. But do note that it is given only for people aged 60 years old and above. The booking for the AstraZeneca vaccine will be available on the website as well through the Community Clinic Outreach Program. Khairy Jamaluddin also shared that the vaccines will be sent to the elderly care home as well. If you're among the 60,000 individuals that have registered on the waiting list of the previous round, Khairy has assured that you'll be receiving your appointments very soon. 1 million doses of AstraZeneca vaccines are expected to arrive in Malaysia this month. Just a friendly reminder that the AstraZeneca opt-in isn't a replacement of the National Immunisation Program. The AstraZeneca direct booking is offered voluntarily only to those who want it. If you're registered for the mainstream National Immunisation Program, you're still in the main queue, which is currently offering Pfizer and Sinovac vaccines. The exact time for the AstraZeneca booking isn't revealed yet, so stay tuned to us on SoyaCincau.com or follow JKJAV on their Facebook and Twitter pages. Malaysia is ramping up its vaccination, and currently the World Trade Center in Kuala Lumpur is the country's largest vaccination centers that can do more than 8,000 vaccinations per day. Over the weekend, they've increased the capacity by 3.3 times, from 2,400 per day to 8,100 per day. Khairy has also shared that the Bukit Jalil Stadium will soon become the nation's largest vaccination center, and it can do more than 10,000 vaccinations per day. The Special Committee for Ensuring Access to COVID-19 Vaccines, or better known as the JKJAV, has reminded the public not to come too early for the vaccination appointment. If your appointment is at 2 p.m, don't come at 10 a.m. in the morning. You're advised to come just 15 to 30 minutes ahead of schedule. Another reminder is that if you don't have an appointment, please don't try to walk in hoping to get the COVID-19 vaccine on standby. In addition, only individuals with a low-risk status are allowed to enter the vaccination center. If your MySejahtera app is showing low risk or casual contact with no symptoms, you're allowed in. If your MySejahtera app is showing high risk such as patients under investigation or close contact, please reschedule your appointment by calling 1-800-888-828 immediately. Did you get a message from private doctors and hospitals advertising vaccine registration? Well, there's no need for you to re-register if you already registered for the vaccine under MySejahtera or vaksincovid.gov.my. Protect Health, an incorporated entity appointed by the Ministry of Health to manage private medical practitioners' participation for the vaccination program, has issued a statement urging all private hospitals and clinics to stop advertising for vaccinations at their clinic. Several clinics have been selected to participate in the National Immunisation Program. However, they're not allowed to advertise on social media to avoid any confusion or misunderstanding among the public. For clarity, this does not mean that you can pay to get vaccinated earlier at private clinics. Essentially, these clinics are appointed as vaccination centres under the National Immunisation Programme, and the appointments will be sent out by MySejahtera. Whether you're going to get a jab from government health facilities or mass vaccination centres or private clinics, all vaccinations under the program are totally free of charge to everyone in Malaysia. The JKJAV has announced that pregnant women between 14 to 33 weeks as well as breastfeeding mothers will only be given Pfizer vaccines. According to Kyrie, this decision was based on available data. The Sinovac and AstraZeneca vaccines are not recommended for pregnant women because the current data on the safety is still rather limited. So if you're currently pregnant or 14 weeks and beyond, it's not recommended that you register for the AstraZeneca vaccine. As of 17 May 11:59 PM, Malaysia has administered a total of 1,995,893 doses, and 761,263 have already completed their vaccinations with 2 doses. Selangor has the most completed vaccination at 103,891, followed by Kuala Lumpur with 81,009 and Sarawak with 71,969. In terms of registrations, 10,232,913 have registered, which is 42.2% of the targeted population. In sheer numbers, Selangor has the most with 2,646,811 registrations, followed by Johor with 1,227,884 and Sarawak with 1,134,546. If you haven't registered, you can do so at vaksincovid.gov.my or register through the MySejahtera app. Alternatively, you can call at 1-800-888-828. And if you have any questions on the vaccine, you can jot them down below in the comment section and we'll try to answer them as soon as possible. Just a reminder that some of this information might be out of date, so stay tuned to us on SoyaCincau.com or watch the latest episode of the vaccine update on our YouTube channel. If you like this video, give us a thumbs up, like us on Facebook, and don't forget to subscribe us on our YouTube channel and hit the notification bell icon so that you'll be informed of our future videos. This is Alex from SoyaCincau.com. Thank you so much for watching and we'll see you in the next one. Bye!